Hi, my name is Audrey Nguyen, and I'm applying for the Doctor of Nursing Practice program to become a family nurse practitioner. I've worked in various roles over the years in healthcare as a volunteer, as an orderly, as a patient care technician, and I currently work as a registered nurse for the Children's Health Resource Pool at Primary Children's Hospital. I believe it's the gem of nursing. I love my job. It is a high acuity float pool, so I'm trained to work on over 11 different types of units: medical, surgical, cardiac, neurotrauma, oncology, behavioral health, observation, as well as the neonatal ICU, cardiac ICU, pediatric ICU, and my favorite, which is the emergency department. Working in the medical field has been super fulfilling to be able to help people as well as continuously learn in my career, which is why I'm applying for the Doctor of Nursing Practice program. It is a terminal degree and it prepares nurses for advanced practice as well as leadership roles. Weber State's program focuses on evidence-based research, health policy, leadership skills, and clinical skills. Family nurse practitioners are able to utilize this research and apply it to their practice to improve the quality of care that's given to patients. They can care for patients of all ages and backgrounds, performing assessments, medication management, diagnosing illnesses, and creating treatment plans. NPs are great about promoting health and wellness by educating patients and families about healthy lifestyle choices and disease prevention strategies. To become an FNP, it requires a high level of clinical expertise, strong communication skills, and a commitment to improve the health and wellness of patients and communities, and I believe that I am fit for that role. Some qualities about me that would make me a great candidate is I have years of experience in the healthcare field. I am currently the informatics co-chair over pediatrics for Primary Children's Hospital, as well as a shared leader in the resource pool. I collaborate with many members of the healthcare team and contribute to making changes that improves the quality of care that's given to patients. To be in the resource pool, you really have to love learning, working with so many different patient specialties and populations. I am constantly asking questions and growing a greater understanding of the human body, of health complications, and of interventions. This role has taught me to be flexible, how to be knowledgeable, and how to think critically. I'm ready for whatever type of patient is thrown at me, whether it's a critically ill patient in the ICU, someone with abdominal pain in the emergency room, or educating patients and families about medications before they discharge home. I am prepared, and it has given me a well-rounded clinical background. Working all around the hospital has also helped me to quickly build rapport with my patients as well as my colleagues. I value each member of the healthcare team's contribution and know we can't do this alone. I am a strong communicator. I have learned to actively listen to my patients and help them build trust in their healthcare team. Every shift, I'm educating patients and families and have learned how to communicate effectively. I've seen how poor communication can lead to rehospitalizations and poor health outcomes, especially in vulnerable patient populations. I am passionate about my patients and I care about their health outcomes. Primary Children's has a great culture of professionalism and civility, and this has helped shape my identity as a nurse. It has made me a strong advocate for my patients and empowered me to recognize that I have the power and responsibility as a healthcare provider to implement changes when they are necessary. I love the flexibility of the DNP degree. There are so many different healthcare settings that I would love to work in. Utah has a growing need for primary care providers. We need qualified practitioners for prevention care, education, immunizations, medication management, as well as the ability to see a provider as a new patient. During my education at Weber State for my bachelor's, my professors taught me a lot about Utah-specific healthcare needs, about nursing involvement in policy, and healthcare inequality. I've worked with a lot of these families that do have poor access to healthcare or poor quality healthcare, and it has made me passionate about health equity. I would love to use my degree to improve access to primary care, especially for those that are limited English speaking. I care a lot about women's health, and I would love to help women receive health education, access to contraceptives, disease prevention services, and mental health care services. I'm excited to see what I can do with my project and how I can apply it to my work after I graduate to improve the health and wellness of Utahns. I'm interested in the DNP degree specifically because I would love to teach one day after I gain experience in the healthcare field as a practitioner to be able to give back to the nursing profession. Thank you so much for your time.